Brought to you by Penguin.
Fragile Minds by Bella Jackson. Read by Emma Fryer. Author's note. This book has been pieced together from scattered notebooks and scribbles on hands. Scribbles that became long emails to tutors, initially as an attempt to complain, then explain, then just to document. I've written with the guidance and support of ex-patients, psychiatric survivors, and mental health practitioners. The stories I tell here are based on real situations, though the patients, staff, and settings are composites, and I've gone to some lengths to obscure their identity, changing names, physical details, timelines, and histories. The healthcare professionals and settings reflect some of the attitudes and approaches of some of the people I encountered during my training. I've given people names to make them come to life, but they do not represent or reflect any actual single individual or place of work. I hope I have done justice to the individuals and their families, and that these stories help amplify the voices of both the rebellious staff and those who are silenced by their labels, disordered, dysfunctional, or ill. I'm aware that I only tell some stories and omit others, that all stories told bear counterbalancing occurrences. I'm not refuting those. In the act of recording, I am being biased. I'm showing only a fraction of the whole. But a finished quilt is made from many patches, clashing, partnering, vibrant, faded, each a unique moment needing to be acknowledged and remembered. Chapter 1. The Door. The 3-story building that housed the acute psychiatric ward squatted beside an industrial estate. It looked insignificant from the outside, a blocky cream-coloured structure with a fresh blue and green sign, Centre for Mental Health Care. As I turned off the pavement towards the sliding entrance doors, a raised bed filled with yellow flowers protruded into view. At its centre, a shrub had been pruned into a lopsided sphere. It was my first morning on placement as a student mental health nurse. Learning on the job would make up a large portion of my 2-year postgraduate training, with university days threaded throughout. The course had started in the classroom 3 weeks earlier, via introductions and welcome material. To my surprise, I found myself having to articulate to myself as well as others why I was there. Why was I there? I'd been working in social care for 5 years, and though in many ways this step seemed like a tactical career move, it very much felt like a venture into the unknown. In previous jobs, I'd worked regularly with people in mental distress, struggling with panic, anxiety, loss. Yet mental illness felt perplexingly delineated from both my life and my work. It existed just out of reach. The clients who were assessed and swiftly directed off elsewhere, the voyeuristic documentary on TV, a garish headline in the newspaper, a man on the bus talking to his reflection in the glass. It seemed perceptible, yet frighteningly undefined. Nebulous, it loomed over me, a presence I couldn't shake. What I needed, I reasoned, was to understand. To open all the doors into psychiatry and stand right up close to the people within. The reception area was empty. It looked like any other hospital waiting area. Rows of plastic chairs, magazines, innocuous prints of flowers on the walls. I'd been expecting something more otherworldly. A bulky man behind the reception desk was watching me expressionlessly. He nodded. "Can you sign in?" he asked. I gave him my details and printed my name on the staff sheet, my heart thudding steadily. "Wait," he said, gesturing to my lanyard. "Is this quick release?" "Quick what?" I replied. The man stared at me. "I'm going to pull this," he said, as if he was explaining to a child. He clasped the strings around my neck. "To check it, okay?" "Okay," I said, unsure. He gave a short, sharp tug, and the lanyard snapped off cleanly. He handed it back to me. "Good." He turned back to his computer. "You can go in now." His large forearm directed me towards the corridor behind him. "Right," I replied, still gripping my lanyard. "Thank you." I followed the corridor, reclipping the loop of fabric round my neck and imagining the consequences of a lanyard that didn't release. Some meters down, I stopped in front of a heavy air-locked door.
Sample complete. Ready to continue?